Hello, everyone. Welcome to our annual symposium. This year, we're focusing specifically on research and campaigns. And in this episode, we're going to be discussing how those research and campaigns look like when they're focused on LGBTQ people, health, and well-being. And today, I'm joined by Dr. John L. Whitehead, who is a board-certified general surgeon who has a practice in Miami, Florida with his husband, Dr. Ramirez, and it's dedicated solely to gender affirmation surgery. So first of all, I want to say, Dr. Whitehead, thank you for being here today and for joining me.
Thank you for having me.
I first wanted to get into just broadly, how did you get into the work that you do?
So interestingly enough, I practiced for many years as a trauma surgeon, and with trauma surgeon comes disfiguring. It disfigures your life a little bit. It can, but it also leaves you with some physical battle scars. And so I had a little bit more of some interest in cosmetic surgery and how to make these things look better as a result of other surgeries that I had to do on a patient in an emergency. And then as sort of time went on, one of the things that always sort of bothered me when you're working in a large institution like a hospital is I sort of felt that there's a big disparity in the way that people are treated who might be different from someone else, another provider. At the time when I was getting my own training and I was an out gay guy, I would hear, openly homophobic jokes in the hospital told by other professionals. And obviously this it's difficult to hear. And then a patient might come in, you might hear people talk about that person. It's just because somebody is different than somebody. And I always said that one day, if I could create an environment which was a little bit safer and could be a little bit more trusting, which is what you need when you're putting your life in someone's hands. You're going for anesthesia, you're giving up all control. You want to know that that person really cares about you and doesn't have something against you just because you might be different. So sort of, I guess this is a long answer to your question, but as time went on, I sort of see people who are gay and lesbian are a lot more accepted in society. It's a lot more kind of becoming mainstream. But I'm starting to see sort of some of those same problems with the way transgender people are treated in a hospital. And so my husband and I decided that let's open something where we could take people and we could treat them and we could help them with surgery, which is where we get into transgender surgery. And we could do it in a private setting, in a setting that's very unique. And when you come to see us, it's basically your family and my family helping you to achieve the best of who you can be through surgery.
Thank you for that. And thank you for the work that you do. To zoom a little bit back out, just in terms of talking about LGBTQ people's overall health and well-being, we know the pandemic has completely transformed the way we view and experience health. So when it comes to LGBTQ communities, what have you seen from the patients that you work with? How has it affected them?
The pandemic in specific, I think one of the biggest things that the pandemic did to especially my patients was when COVID was first rearing its head, nobody really knew what this beast was going to be, how we were going to take care of it, what was going to be happening in terms of resource consumption in a hospital. And so, you'll remember that the hospitals basically got shut down. We shut down all elective procedures, and even though I realized that gender affirmation surgery is not necessarily elective, but it's not a life and death right now surgery like you're shot by a gun or you're hit by a car. So all of these surgeries got put on hold, and they got put on hold indefinitely. We didn't know how long that it was going to be till we got a handle on the pandemic till we could open up. And then obviously everything that got put on hold was put on hold for hundreds of surgeons that now got in the queue behind each other. And once things finally opened up, things were very slow to reschedule all this stuff and get rid of this backlog. So, you can imagine that for a lot of my patients, this is the one big procedure that is going to change their life, that they have literally been looking forward to for their whole life. And it takes a lot to get ready for this surgery, financially, socially, emotionally. Most people have to travel to come to see me for surgery, take care of patients from all over the country. So by the time you have that plane ticket and you have that hotel and you have a friend who's going to come with you to be your support, and everything is ready, and now everything sort of gets canceled, it was a really difficult emotionally for a lot of people.
So, you specialize in gender reassignment surgery, as well as breast augmentation surgery. What role do you play in patients' overall health and wellness from the time they have a consultation with you through post-op?
So the cycle on the entire process is rather long, I would say. For preoperatively, there's a few things you have to have in order. The patient should be living in their identified gender for over a year. They should have been on some hormone therapy for over a year. And these things, the patient may come to me when these things have been in place for a decade, or they may come in to me and see me and ask them to get help actually started even just with hormones right from the beginning. So even if it's the former case where they're living in the identified gender and they've been on hormones for 10 years, even so, it still takes a little time to get ready for surgery and to actually have surgery. Then once the surgery is done and through the whole process, I mean, it really amazes me that I would say upwards of 99% of the people that I've operated on don't have a friend who has gone through the same procedure, that they can even just call and say, hey, what should I expect next? Hey, how did this go for you? Is this normal? Should I feel this sensation? So we end up being that special friend, in addition to physician, to a lot of people. And I think it's very important that the patients have somebody's hand to kind of hold through this emotionally and everything. It's a lot of work that goes way beyond the operating room for both myself and my husband, but it's a necessary thing. And I really do believe that the more comfortable you are emotionally and psychiatrically going into this whole procedure, I think you have better outcomes. I think you heal better, and I really do think you do better.
So when it comes to these practices that you developed in terms of wanting to make sure folks have enough lead time to really think about it from an emotional and mental standpoint in terms of going through surgery, are there certain pieces of research that you've used that have informed your practices of how much time that takes, all the way down to post-op? What is best for kind of communities of practice, making sure that people who have been through this feel that they're getting the support that they need post-op?
In terms of actual like hardcore or published research, I would say no. This is just more of the what we would commonly say is the art of medicine. It's more how do you feel? How do you gauge how the situation is going? Everything. I think everybody is different, and I think people come to us at various points on a spectrum of sort of readiness for surgery. And when you have a patient that is just ready, they're beaming, they're ready to go, they've done their research, they're not scared about anything, and they're just ready to go. Other people, you sense a little hesitation. Normally, I mean, I had foot surgery a year ago and I was scared to death, and I'm a surgeon, so I mean, I understand it. But the time that we take to develop the relationship and for the patient to feel absolutely comfortable with me and to trust me, is worth whatever time it takes, because when you develop that bond and that trust, and you know that the patient is comfortable putting their health in your hands, again, everything just works out a little bit smoother.
Have you had folks come to you wanting to get your expert advice on some things that you mentioned in terms of timing? A lot of this is art. A lot of this is patient by patient. But have you had folks come in who are wanting to start their own practice or wanting to do some of this work, asking for your expert advice or opinion?
So I have had a lot of people call me saying they're interested in learning how to do the surgery, or doing the surgery. And that's a difficult thing. One of the interesting things is the surgery is not really, or hasn't been up until maybe now, a part of a medical school curriculum, a residency training program, a fellowship program, or anything. So certainly these surgeries have been being done in other countries, and even in the United States, in more kind of clandestine offices, not part of general academia. And there's a number of reasons for that, probably, which is probably another whole podcast.
Exactly.
But so it's difficult, because if someone comes to me and says, "Hey, can I come and shadow you for a day and watch the surgery?" I want to help people and I want to increase access to care and everything, but a day is just going to give somebody enough information, even a seasoned surgeon, enough information to kind of be dangerous. So what I think is super important is that we have a good sort of communication among all of us as medical professionals and allied healthcare professionals, and that everyone knows somebody that can connect somebody to a surgeon who's skilled in the art of gender surgery. And when we can sort of all rely on a network. If you need a surgeon, here's how you get to find somebody who is going to do a good job safely for you.
So you all have kind of developed your own community of practice amongst doctors who specialize in this surgery.
This would be the World Professional Association for Transgender Health, the WPATH for short. It's an international consortium which I joined very early on when I got into this field of medicine, and it's really a spectacular organization. You were talking about research a little while ago. Hard research on a lot of the surgical issues, techniques, outcomes, long-term outcomes is really not there. There's some, but it's really unlike any other body of surgical literature that you would look into. So we're in the process, I think, as these procedures are becoming a little bit more mainstream and some more people are doing them and they're funded more adequately and properly, that we're starting to collect more data. But it's just not there yet. The WPATH does a great job of bringing people and professionals from all over the world who we all are developing our own best practices. I do this procedure a couple times a week. I do it for years. I start to tweak it and figure out what works best for me. Well, now I can go to a group of surgeons that are all focused on gender surgery. We can share these tips and everything, and hopefully come up with better procedures to deliver better care for patients. And the same thing, it's not only surgeons as part of the WPATH, it's anything transgender health. So from mental health to endocrinology and hormone help and addiction, other illnesses that are commingled, more highly associated in the transgender person than the general population. So it's really just an organization that really strives to deliver the best care for transgender people everywhere.
And it might be higher in the transgender population because of the discrimination and the bigotry and transphobia that they may be experiencing, correct?
Absolutely. I mean, probably you and I had a good fortune to come from a family that was loving and accepting and helped us through college and all of that, and our biggest concerns were getting an A in organic chemistry so we could go to medical school. Somebody who has been shunned by the family and hasn't been accepted and maybe has been kicked out and is homeless on the street is just trying to get dinner for the night. You
Right.
know, and obviously there's so many more obstacles, and we do know that there are higher incidents of substance abuse, of depression, of suicide in the transgender community than in the general population, and probably just a tough life for a lot of people because of the exact same things you said, um, just have made it difficult.
And how much as a society we very much are very binary of male or female, and anybody outside those boxes is immediately to a lot of people in the United States, something that they don't understand and they're fearful of. And so I think a lot of the work that you do is wonderful in terms of making sure people feel that they can be themselves authentically. You mentioned the commingling of some of these different things in terms of mental emotional health, in addition to just the surgery aspect. In addition to the work that do you have a consortium of folks that you refer patients to, that you really trust and rely on for some of those aspects?
Yeah, absolutely. I was lucky enough to meet a few therapists in the Miami area where I practice that I've gotten to know over time. I know how they work. I know what their assessments are like and how long they work with the patient to come up with their diagnoses and their referrals when the patient's ready for surgery. And I really trust these people, and it's very important to me to have a referral for surgery from someone that I really trust their opinion. Um, it's interesting because a lot of times um, some of my patients will come to me and say, "Oh, this is just another, this is just another hoop that I have to jump through that the medical community is presenting to prevent me from getting surgery." And I really don't want people to think about that. Number one, it's not a treatment program. We're not saying that this is an illness or is a pathology that you need treated. It's just really for me to make sure, since my background is not psychology, sociology, any of these things, to make sure that there is nothing else underlying which could be confounding the diagnosis or the fact that surgery is going to be beneficial for somebody. And of course, someone could be transgender and surgery could be absolutely appropriate for them, but maybe it's not appropriate right now because too many other stresses are going on. Something's going at home, something's going on at work, and the surgery really does take a lot a lot of emotional wherewithal to get through the surgery. And in addition to everything that probably just comes with the stress of surgery, I also stop your hormones for some time before, for medical reasons, not to put you at an increased risk of a blood clot or anything like that during the course of surgery. But that also, it's like going through menopause for my trans feminine patients. So it plays a little bit with your mind as well.
Well, and it really goes to your point about the longevity of how long your relationship with your patients lasts. And so you're really happy to hear about the work that you do in Miami. How many other um, organizations exist like yours throughout the United States? Are you fairly uncommon?
I think that I think that we might be the only gay husbands that have a transgender practice in the in the country. I know that they're few and far between. I commonly am seeing patients from all over the country because there's just not an adequate number of providers wherever the patient lives. And from insurance companies will typically give patients exception requests to come and have surgery with me because even the insurance company knows there's no one that is in your area that is a provider of this type of operation. So I think that there's probably very few, maybe less than 20, who have a dedicated practice to transgender surgery exclusively like we do. I think there's a handful more of people that might do a mastectomy here and there or a breast augmentation here and there. And so there's some more people in that regard. But I do think we're pretty unique in what we offer from even a social perspective.
And final question, in terms of one of the items you mentioned earlier, that there's just not a lot of training around this. In your opinion, what do you think is missing in regards to and again, at a high level, LGBTQ research and campaigns specifically focused on LGBTQ people and their health and well-being? What do you think is missing in terms of a high level perspective, but also just in the work that you do? What do you think could change the game in terms of making sure people get adequate healthcare that they need?
I think a lot of these things are just slow. I think anything in academia and in medicine takes some time to really catch on and to really come to fruition such that there's a useful tool. For instance, there is a lot of data collection in the surgical community for various different things. There's, as a trauma surgeon, when I practice trauma surgery, there's a whole national trauma registry where we track every little thing to do with the trauma patient. And from that has come best practices for, again, just about every little thing in trauma that most of us in the entire country practice by. And we know that we give better care to our patients because we do practice these guidelines, which have come out of data from hundreds of thousands of trauma patients. There's very similar things for just about every other aspect of medicine that you look in. Not so with transgender surgery yet. If you do look at any data that you can really find on transgender surgery, at least what I've found so far, is this data comes out of the American Society of Plastic Surgeons. I think it's grossly misrepresenting what's actually going on in this country, because plastic surgeons are certainly not the only people that are providing these services. You have general surgeons like myself, you have gynecologists like my partner, you have a urologist like the mentor that trained me, who was a pioneer in this type of surgery. So you're missing all of that data. I'm hoping that, and one thing that I'm particularly interested in, and I want to see if I can get more involved with, even with the WPAP, is if we can start to create a data repository for all of this information, so we can collect from all these different types of surgeons who are doing this kind of work now, get everybody's data, and really start to come up with what is the best way to do things.
Wow. Thank you so much, Dr. Whitehead, for speaking with me today. Really appreciate your time, and hopefully we can chat again soon.
Absolutely. Thanks again for having me.